It's a huge honor for me today to be interviewing an idol of mine, a mentor of mine, Steffany Mohan. I swear to God, you've been crushing it. I'm born and raised in Kansas. I went to Omaha for undergrad, Kansas City. Then I moved out here to Phoenix when I was 24 in 1987. And I love people that are crushing it in Kansas, Nebraska, Iowa, because so many dentists, they always have this excuse in their head. Like they'll go to Pain Kansas and say, "Yeah, but they're in Key Biscayne, Florida." You'll show them something that some guys do, and they'll say, "Well, he's in Beverly Hills. You know, Ziv's in Beverly Hills, and Dorfman's
Yeah.
in Beverly Hills. I'm in Parsons, Kansas, and
Yeah.
you're in something smaller than Parsons, Kansas." And
Ah,
you're just crushing it. Yeah, I mean you're crushing it in what I call the real world. I mean, America's got 330 million people. Whenever you go to another country, they only know the towns like
yeah.
New York City or L.A., and they never heard of Kansas or Iowa or whatever. So how do you make it? How's a small town girl like you make it in a small town Iowa?
Well, I think it's easier. I think it's easier than, I mean, I can't imagine living in California or living in New York. I mean, people haven't discovered yet how great it is to live in Iowa. So it's a wonderful place to live. And I think it's so much easier because people still live here, but not that many dentists live here. So I think it's great. I mean, I think you go to live where everybody doesn't want to live, and then there's still people to take care of there.
Now Iowa has a dental school though.
We do. Yeah. It's a couple hours away from me.
Yeah, what city is that in? Is it Council Bluffs or
Iowa City.
Iowa City?
Hmm.
And how big's their class?
About 75.
I don't want to point out the obvious, but I'm going to have to point out the obvious because I get this question a lot, and I don't think and the only reason I'm asking you is because you're a leader, and I'm not in any way, shape, I qualified to answer this question. I get in practice manager, I get this question at least probably every 2 to 3 weeks by a young female dentist, and she'll say it's not fair. Because when male dentists tell an all-female staff to do something, they jump, they go blah, 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 blah. And then when I tell them the exact same thing, I was this guy's associate for 3 years, and he'd say, yeah, get me a cup of coffee and call my wife and do this and send this as flowers. And then when he's gone and then she buys brightens, he does it, they all react totally differently. Now, is that just her imagination or because you have to admit, what percent of the employees in dentistry are women? What percent?
99.
99%.
Yeah.
So my question to you, Steffany, you've been leading an office for 19 years. Do you
Yeah.
think a 99% employee base in dentistry reacts differently to a male dentist versus a female dentist?
So, first of all, I think that they're right. It's not fair. But
So
I
you
was
believe
raised
it
with,
exists?
well, yes, but I think that it's also baloney that lives in your head. So, I was raised to believe that life wasn't fair, or I was told life wasn't fair. I'm sure you were too. I'm not sure that our young people coming out of dental school were raised to think that life isn't fair. And so I never thought anything about it. I mean, it was kind of a minor blip for me. I think that, sure, do they react differently to me than they do male dentists? Absolutely. Does it get better the older that I get? Yeah, but that's me actually. That's my confidence. That's my way of dealing with people. That's the way that I respond to them more so than how they respond to me. If I don't feel like I'm worthy of being their boss or being their leader, then that's my issue. That's not their issue. Yeah, they do. I mean,
So
we're all,
so what I
but
just
I
heard.
think in some ways it's actually easier because I think that we understand each other more. We're moms. We understand that we have kind of some of the same issues sometimes. I can be, on their level, but still be their leader. Those aren't mutually exclusive.
You're qualified to speak on so many subjects, but I want you to. If I asked 1,000 million dentists alive today, what's the most stressful part about being in dentistry? They're not going to
Oh,
say getting a block. They're not going to say
no.
seeing a. They're always going to say dealing with staff. So
Yeah,
since
every time.
since 99% of all the employees are women, and since you're a woman dentist and a very successful woman
Yeah.
leader, what insight could you give? There's about 7,000 viewers listening to each one of my podcasts, and I assume probably 5,000 of them are men. What advice, being a woman dentist, what advice would you say, or pearls or anything on how
Yeah.
men could effectively better communicate with an all-female staff?
Oh, men?
Yeah.
I don't know. I
No,
don't understand women any better than men do.
so no, any I mean, do you see common
um,
mistakes in men trying to be leaders and not
so
understanding certain? I mean, you see
I
low hanging fruit.
I think so. I think a couple different things. I think, you always be straightforward and honest with women, even though they're probably not always going to be straightforward with you. I mean, women have a way of you have to meet them on their level. You have to kind of understand that life is hard for some women. They weren't raised the way that everybody else was raised. I mean, they're not the I mean, women are great, right? But they need to be reassured a lot more than men, a lot more than men. Even me. I mean, I need more reassurance than my husband does. Um, I think that it's really important to make sure that that you're communicating with them and don't just assume. And that's just any relationship. You don't want to just assume that everybody's okay. I don't know. I don't know how men are supposed to relate to women easier. I mean, that's a good question. What do
It
you
it,
think?
it is bizarre because I was the only boy because my brother wasn't born until I was 17 because my
Yeah.
parents were Catholic and they didn't believe in birth control and all that stuff. So
Right.
he was just a little accident. And my mom would dress me in blue jeans and iron patches on the outside, and I had no curfew. I had to be home when the streetlights came on. She put my sisters in dresses, and if they
Yeah.
soiled their dress, they'd get in trouble. And then
Yeah.
when we lived about 100 yards from the Arkansas River, and I could swim in it and fish in it and whatever, they couldn't
Mhm.
go within 10 feet of the edge.
Yeah.
And even at 10 years old, I just thought to myself, well, this
Yeah.
is batshit crazy to me. What is my wiener going to do in the middle of the river
Yeah.
that my sisters are going to drown because they're missing?
And and I grew up with the dad that threw me in the river and
that's
said go swim
probably
with the guys.
that's
Yeah, and
probably
and
why
he
you're
did.
like you are.
Well, he didn't want there to be barriers to where I could go and what I could do. And so I was a huge tomboy. I mean, like think I leave my hair long so that I can not be a tomboy anymore, So I mean, I always and I think my dad purposefully moved us into neighborhoods with only guys. I mean, I only played with boys when I was a kid, and it was just the way it was. But I never wore a dress. I had really short hair. I was just raised to be a tomboy.
I can't imagine you a tomboy. I want to ask you another question that blows my mind
You'll have
too.
to
You're
pay big for the pictures.
you're always on television. I mean you're like a media star in Iowa. How there's how many dentists are in Iowa? 1,500.
Yeah, about
So
I think that's about
1,500 dentists. Why are you the one always on? Is that just because you're hot, or was it networking, or did
oh,
you
thanks,
buy
Howard.
a PR
Uh,
firm get you that spot, or
Actually, I kind of just accidentally lucked into it. I did Randy Alvarez's Wellness Hour, and so I shot his 30-minute commercials that he does that are really, really, really powerful with patients, especially patients that haven't been in for a long time, the really fearful patients. And then what I ended up doing was putting those on a couple of different TV stations in my market and finding out that it wasn't as expensive as I thought that it would be. Certain markets really aren't that expensive. I mean, sure, if I tried to go to New York or LA or probably even Phoenix, I'm sure it would be much, much more expensive. But really, advertising on TV in my market isn't that bad.
be
And
specific? How much was it to produce at Randy Alvarez, and how much does it cost
well,
to
producing
air it
Randy's
on?
show is different, but like actually how to air it, sometimes it would be like between $200 and $300 for a 30-minute spot.
Oh, so when you went
Yeah.
to Randy's, did you make one
I
deal
made two. I made an implant and a 6 month smiles.
implant, and were they both the same length?
Yeah, they were both 30 minutes
And you're saying that it costs about $300 to run that for how much? Three hundred
to run it
dollars,
for
so a
Yep.
dollar a minute.
Yeah, not what you would think. You'd think it would be a lot more than that.
And every time you run a $300 30-minute commercial infomercial on implant six of style, do you usually always get a patient, or do you get two or three, or
The first time I ran one 30-minute, I got 10 phone calls within about a half hour.
wow?
So yeah, I know, crazy. It was crazy. So we consistently get quite a bit from that, but that
And
kind of got me
how often?
into the TV world, where then I go on to the morning show and I talk. I mean, and I love to educate people just about. I mean, I want people to keep their teeth for their lifetime, like just like every dentist, hopefully. And so it's really fun to just talk about simple things that people can do to keep their teeth and to not have trouble and not spend too much money and all that. So it's fun. It's fun for me to go on TV.
The only television station that will let me come on is the Blind Television Network, and that's the only one. But that so how many years ago did you do Randy Alvarez?
I think it's been either 2 or 3.
And you thought that was a good return on investment?
I loved it. I thought it was great. I mean, Randy's so professional and so
Are you
easy to
friends
work
with
with.
him? You friends?
Yeah, sure. Yeah,
Well,
he's great.
tell him I want to do a podcast with him.
Oh, yeah.
And talk about that. I
Yeah.
also want to ask you this. When I got out of school in '87, I mean, seriously, it was Kansas City, Missouri. I mean, I remember the instructors in the lunchroom or at the bar after class talking about these two oral surgeon guys placing implants. They were doing blades,
Yeah.
Ramus bars, and they all called them butchers and
Yeah.
quacks, and these guys should have their license taken away, and they were nuts. And some of the real famous implantologists back in '87, '88, '89 in some of these redneck states got their license taken away because of
Right.
a failed case. And now
Right.
I'm 52 years old, and now there's 274 companies selling dental implants.
I know.
So I want to ask you, how did you? I mean, I'm sure you didn't place an implant in dental school.
No, no,
So
no,
tell
no.
us your journey to dental implantology and how has that affected your practice?
Yeah, so it's funny that you asked that because I graduated from University of Iowa in 1996. And when I graduated, or the year that we graduated, so our senior year, they let us Nobel came in and let us put all the pieces and parts for prosthetics together on a desktop. But essentially what they told us at the time was that we'd never be smart enough or good enough dentists to ever put in an implant, that we just leave that to the surgeons, and that's Nobel's platform really almost to this day. And so, I mean, it's changed recently, but for pretty much oral surgeons were the people that placed implants. And then all of a sudden, periodontists were placing them and then endodontists were placing them. And so it was sort of like a realm of the specialists. And what happened to me is that I met a couple people along the way. And that's what's so great about meeting amazing people like yourself in dentistry, because it kind of makes you think differently, and you learn that oh, wow, you mean what I was told 20 years ago isn't necessarily true today. And so really I had placed a few implants kind of along the way, and then I met Todd Shatkin and started placing some mini implants. And then what I realized is that it's not that, minis are great for dentures, but it's not something that I really want to do for, regular cases or, crown and bridge cases or full mouth cases. And so and I love Todd, he's like one of my good friends, but then, along the way I met Brady Frank, and Brady is such a revolutionary in the field of implants because he said, not only should general dentists be doing this, but otherwise the field of implantology isn't going to get that much bigger because general dentists don't understand what patients should have an implant, what patients shouldn't have an implant, you can refer as much as you want to the surgeon, but a lot of times the patient just doesn't trust the surgeon. They trust you. And so they come to your practice and they want you to do the treatment because they understand, they like you and they know you and they trust you and they want you to do it. So I had been placing some implants before I met Brady, but when I met Brady, it kind of threw jet fuel on what I was doing. And then to throw it on top of it, not only is he just this amazing educator, but then he also was able to bring the cost down. So instead of breaking open a package for, sterile package for an implant, that's $400, it's $120 instead of $400. So
With Brady Frank?
Yeah, so then it brings the cost of the implant
What
way
system
down.
implant is he using?
It's OsteoReady.
Oh, OsteoReady. Is he the owner of that?
He's the owner of that, yeah, and the founder, yeah.
And where's that out of?
It's out of Seattle.
Huh. Well,
Yeah.
Can you call him?
So
I
it's
want a
GP
podcast.
driven. Yeah, you got to
Can you
interview
fix
him.
this
He's
up?
amazing. Yeah. He's one of the coolest guys you'll ever meet.
I
Yeah.
thought you were the coolest guy I'll ever meet. Yeah. Set up. He's out of Seattle, huh?
I was only a tomboy for 12 years, and now yeah.
Now you're the coolest chick I'll ever meet. Yeah, if you could send us both an email or set that up.
I totally will. Yeah.
I'm going to go ahead.
So implants, I mean, the way that it changed my practice, though, is that what I was able to do is bring implants, a simple 1-unit crown implant to a patient that maybe wouldn't have been able to do it before, because now it's the same cost as an endo and a crown, whereas it's heroic to try and save the tooth, but an implant at least saves the space, and lets you place something there without having to hope that the tooth doesn't fail. And implants fail, sure, sometimes too, but it's a much, much more predictable service for the patient. And if we can get the cost down so that they can actually feel good about what they're paying for it, everybody wins.
Okay,
So
so you're the
yeah.
one. You're the one that opened the cost Pandora's box. So I'm just going to ask you a simple question. I mean, um, if you send one of the 31 million edentulous people
Right.
to a dentist or a prosthodontist, periodontist, oral
Yeah.
surgeon, whatever, they always, they don't see market segmentation where there's
Sure.
Chevy,
Yeah.
Pontiac, Olds, Buick,
Yeah.
Cadillac. They
It's all
just
Cadillac.
treatment plan 6 implants and a 12-unit
Yeah.
fix upstairs, 6 units implants and a 12 downstairs, and it's $50,000. And
Yep.
Steffany, I'm going to ask you this question. What percent of the 31 million Americans cannot afford a $50,000 alternative to their denture?
Yeah.
Well,
99.
yeah. So
Literally.
and you're in
Yeah.
Iowa. You're not in
Yeah.
Beverly Hills. You're not in
No. 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 No.
Wall
And
Street.
strangely enough, the farmers here have way more money than the people in Beverly Hills.
Yeah, well, that's the deal. In Kansas, if you had a Mercedes Benz, you
Yeah.
bought it in cash. And in
Yeah.
Phoenix or in Scottsdale, if you have Mercedes Benz, you're leasing it.
Yeah.
Yeah, and
It's true.
it's exactly my
And don't judge a book by its cover.
I
That's
know
a bad idea.
My Lexus is a 2004 with 110,000 miles on it. And I don't know anybody who owns a new Lexus that's
Yeah.
not leasing it.
Yeah. Oh
Yeah,
no, I know. I
yeah.
know.
But anyway,
People don't do that here. I mean, if you don't have a, cash or check to pay for it, you don't do that here.
so Stephanie, so explain market segmentation because you're in Iowa
Yeah.
with real people. How do you explain? So grandma comes in with a denture. Do you offer 2 price points? Chevy, Cadillac. Do you
Sure.
have 5 Chevy, Pontiac, Olds, Buick, Cadillac. What do you have to offer?
Well, I think the major mistake that dentists make is they don't really ask what they want first. I mean, they don't ask their budget. They don't ask what they're really thinking. I mean, are they willing to spend $50,000? Sure. In some cases they are, but most of the time, no. I mean, most of the time they either can't or they just won't because they're too practical to do it. But they know, so you have to find out what they really want, right? I
But
mean, do they want
but
something that snaps in? Do they want something that screws in? What do they really want? And then you can kind of work from there. And so usually we'll give them a couple different options. Usually it's fixed hybrid or it's over snap in overdenture. So those are the
But
major
do you just point blank ask them like if I
a
came
lot of
with you,
times, yeah.
you just
Yeah.
say, Howard, what's your budget?
Yeah. Yeah. What did you think you were going to spend on something like this? Or I mean, what did you think it would cost?
And what did they say?
Well, sometimes they say, well, that's why I'm here. I want you to tell me. But sometimes they'll say, well, I went to, the oral surgeon and the prosthodontist, and they said it would cost, 30,000. So I was hoping that maybe I could get it for less. I mean, that happens to me every single day, every day. Yeah.
Yeah.
Which is great.
Yeah,
Yeah.
because the prosthodonts, they I don't think they've
Yeah.
ever heard of a Chevy, a Pontiac, a Buick, or
No.
an old.
And then I say, oh, me. I'll do it for I'll do it for less than 30 grand, of course.
Yeah.
So, but if you're putting in $400 implants every single spot, you can't. I mean, you can't do it for less.
So Stephanie, you wear so many hats in my mind. I mean, you're on television. You're amazing at so many levels. I want you to address this. A lot of these dentists listen to you. They see you and they see an entrepreneur. They see someone who likes
Yeah.
business. You like the game of business. So my question to you is, why do you think you like the game of business? And do you think that's something you were born with? Because talk to several thousand dentists right now who says,
Yeah.
I don't want to run reports on Dentrix. I don't want to talk to my account. I hate
Yeah.
everything about the business. I just want to go in there and work on my patients and take care of my patients. How does a person like that
Yeah.
become an
Well,
entrepreneur?
your dad was a business owner, right?
Yeah, 9
Yeah.
Sonic drive-ins.
My dad was a business owner. So I think that part of it is just your mindset you're kind of born with it. So my dad was a veterinarian. I worked in his practice from the time I was 10, probably maybe even a little younger. I had to clean, cat and dog cages, which is kind of gross. But I grew up in my dad's business. So I knew that it wasn't a 9 to 5 job. It wasn't a 5-day-a-week job. It was pretty much a 24/7 thing. So I think I just never questioned that it was going to be more as a business owner than it was.
Now,
So, 'cause I think a lot of people,
in Iowa,
yeah,
as a vet, was it a vet for dogs and cats or for farm animals?
both. He did both when I was really young, and then he did mostly dogs and cats as I got older. So, yeah. I
How
think a
come
lot
you
of
didn't
people
become
just
a
have
vet then?
unrealistic expectations. He told me not to. He told me go be something easy like a dentist.
And your husband's an internist.
My husband is a general surgeon.
So your dad was a vet. Your husband's an
Yeah.
what'd you say?
General surgeon.
General
Yeah.
surgeon. You're a dentist. Which of the three?
My brother's a physician.
Which three
Yeah.
of those is now that I've seen them all? Which one was the best move?
Dentist. Yeah. No, I mean, my husband loves being a surgeon, but the biggest thing for him is that with the changes with Affordable Care Act, it's just not something that is going to be feasible in the future, I don't think.
But what if he said to you, "Yeah, but Steffany, you're going to get eaten alive by corporate dentistry"?
If you can't beat them, join them.
What does that mean? First
I
of all,
don't know.
first
I
of all,
don't know. I
first of
mean,
all,
you have to evolve.
do you think corporate? Do you think what the Affordable Health Care Act is to physicians, corporate dentistry is to dentists, and what do you think of
Yeah,
corporate
yeah. In
dentistry?
some regards, I mean, the difference is there's such a big difference in corporate dentistry, right? There's people out there that are doing it pretty well, and there are people out there that are just slaughtering the field of dentistry. I mean, there's just people that
Can you drop
really have
names?
no business. No, no. I'm
I,
still
I
trying to be popular.
I can't. I'm trying to get you to. But
Oh,
but
okay, yeah,
but my benchmark on those changes is just one question: how long do you
yeah,
keep your average dentist? And those changes
right,
you're talking about, their
yeah, yeah,
average dentist doesn't even work for them for 1 year. Are you
right,
shitting me? You're a dental
right.
office, and
Well,
no one
because
stays
they're
for
making them violate their ethics on a
right,
daily
right.
basis. I
But
mean, you can't do
that should
that.
be the ADA. The ADA
Yeah,
should be publicly
yeah,
posting the corporate dentistries and how
yeah,
long the average dentist stays there. I mean, imagine if
right,
Walgreens couldn't keep a pharmacist
right.
for
Yeah.
because the pharmacist felt morally
Well,
outraged.
but dentistry will be pharmacy at some point in time.
Do you believe that?
I do. I mean, I don't think it'll be, I think it'll be 50 years, but I think it will absolutely be big operations. I don't think it's feasible for dentistry to stay small mom and pop. Look at Walmart, look at Walgreens. I mean, look at industries that, I mean, big business buys out small business.
And especially with dentists' love for technology. I mean, every dentist says, "Oh, well,
Yes.
you got to have a CERAC, you got to have a
And
CBCT, you got to have a laser." Well,
yeah,
just yeah, buddy. Yeah,
and their dislike for running their businesses. If they run their business, then people wouldn't be able to come along and say, I'll buy you and I'll pay you 250 grand a year, and that's twice as much as you're making.
but every time a dentist goes out there and says, "You got to have a CBCT, you got to have a $75,000
Yeah.
laser, you got to have a," well, then you're just guaranteeing corporate dentistry because the
Right.
scales of
Yeah.
economy that's only going to
Yeah.
work in a group
I
practice.
mean, there are 5 dentists in my practice. I mean, I'm the sole owner, but we have 5 dentists in my practice, and there's only so much. I mean, like people cater to us so much more than they would a one doctor practice. I mean, we get so many more perks than a single doctor practice. I mean, we get benefits.
But what if I made this prediction, Algie? You said in 50 years we'll
And
probably
we're not corporate, clearly. I mean,
right.
like, we're just a private practice with a bunch of dentists.
Well, actually, we got to get a new name for corporate because every dentist that's ever told me they hate corporate, they're incorporated. I'm like, dude, you're an LLC.
Yeah, right. Yeah,
You're a
exactly.
PC.
I mean, we have to do apples to oranges. I mean, that's what I mean. Like, there's some in corporate dentistry that have no business being in dentistry at all, and then there's some that are actually doing it pretty well.
Yeah. But what about this analogy? Because nobody can predict the future. I mean, who knows? I mean, who guessed last month that China's stock market would fall 30% this month?
Right.
I mean, it's falling at the level. It fell the same
Right.
as what we did in 1929.
Yeah,
I
I
mean,
was in China a year ago.
well, if a market drops 20%, it's a bear market. They
Right.
dropped 30% in a
Yeah, that's
month.
crazy.
So who even knows? So no one knows the future. But
No.
my son Greg Farran always reminds me that lawyers went corporate before anybody in physician did, and right now they for 2 decades they've stabilized at 50% all work for big firms and
Yeah.
50% stayed solo.
Right.
And Greg thinks that dentistry is going to do the same. Half will be
I can,
in
I
big
can see
corporate,
that.
and
Yeah, I
half
can
would
see
be
that.
solo. Because lawyers, they
Yeah.
got 8 years of college. I think the biggest problem with dentists, physicians, and
Yeah.
lawyers is like herding cats. The
Yeah, it
largest
is.
employer in the world, Walmart, has the highest percentage of people that don't have a high school education. But when
Right.
you start getting to law firms, and you can't get 2 lawyers to agree that it's Tuesday, so a lot of them just can't work in a
Yeah.
group. A lot of.
Yeah.
So I want to ask.
Well, I mean, I think you're probably right that there may be like a certain point. I'm just afraid that a small practice can't compete long term. But if they do it really well, of course they can. I mean, anybody that does business very, very well, they'll be fine. But medicine kind of did the same thing, whereas, 10 years ago or 15 years ago, there were just a tiny percentage of physicians that worked for hospitals, and now it's 50%. 50% of physicians work for the hospital.
So back to that question, and I know I
Oh yeah,
interrupted
go
you trying to answer it.
ahead.
Um, how can you as a leader motivate a younger kid dentist to get more interested in entrepreneurism, in business, and running the Dentrix reports, and getting interested in marketing, and
Yeah.
getting? I mean,
I,
would you
I
say
think that you
would
have
you
to,
say if you just don't like it, you need to go work for someone like me, you, or a
yeah,
corporate chain,
I do.
or do you
Yeah, I
think it could
do.
be nurtured?
If you don't want to have 12 books beside your bedside table that have to do with business and marketing and economics and all that, if you don't have that and you don't want that and you don't want to do that instead of watching Big Bang Theory, then you really should be a worker bee dentist. You should. If you're not interested in dentistry, and if you're not interested in the business side of dentistry, you should go work for somebody else because otherwise it's going to become increasingly hard for you to make a living as an owner dentist.
So you're saying, yeah, if you're not passionate about it, you're never going to be good at it.
Well, I mean, I think people have been able to do it for a long time with because it hasn't been as sophisticated, and now sophisticated companies are moving into dentistry and taking over where there's been disinterest in running the business before. So if you're really not interested in running the business, be honest with yourself and go work for somebody else. I think it's not going to work long term.
Right. So Stephanie, you and I have another thing in common, and that is we both have dentists working for us, and neither of us were interested in a partnership. And I'll tell you my reason
Yeah.
first, and I want to tell you why aren't you partners? I always
Right.
figured that when you get married, you have great sex, you have children, you spend evenings and holidays, and that fails 50% of the time. So
Yeah.
really, you want to marry a dentist, no sex or children involved, no weekends or holiday. You're going to marry a damn dentist. And I also can can just give you the names of hundreds of dentists that say the divorce breakup with their partner was
Yeah.
worse than the divorce breakup with their lover. How come you don't
Yeah.
have any partners?
I haven't found anybody yet that's as passionate about the business side as I have. I don't know anybody else that has 12 books by their bedside table. I mean, I don't. And my husband is exactly the same way. He doesn't want anything to do with business at all. He's a shareholder in his, multi-specialty group, but he doesn't want to have anything to, he goes to the meetings and he participates, but he's never educated himself about the business side of medicine. And that's all I ever wanted to do. I mean, I wanted to become educated so that I could take care of my patients on the clinical side, but I also wanted to make sure that my kids would still be fed and that my business was not going to go under. And that was really important to me. But I was really curious about it. And I don't, if the curiosity isn't there, just like the passion isn't there, then you're toast.
Now, do you have any specialists in your practice?
I don't. Mm-mm. But we all, I mean, just like I'm sure, I mean, I'm teaching my docs all to do implants. I'm teaching them all to do
You
six
teach
month
them
smiles.
yourself?
And
You teach them
um,
yourself?
I do a lot of mentoring. We do a lot of, I mean, tomorrow we have like 25 implants that we're placing. The two of my two newer docs will place 25 implants tomorrow with me over their shoulder.
Okay, so I'm just going to go right
So,
to specifics, and let's just try to get down to there's 274 implant companies. How,
yeah.
how many systems did you have to buy? What if some young dentist 5 years out of school saying, "Steph, I only got enough money for one system. I don't
Yeah.
want to. I don't want to do three." What would you
I'm
What would you
really
tell
lucky.
them?
I only bought three before I settled on one. I mean, I know people, and I've had people come to my courses and they say, "Oh my gosh, I have like eight." And so, yeah, I
I
mean, I
have
have how
six.
many? Yeah, I have how many? Well, see, I'm half as good as you.
No, you're half as dumb as I am. I had to go through six before I found one that worked, and you found it in three.
Yeah.
So so
Well,
so
I
what would be
know
the
that I
shortcut on
needed.
that? What would
I
you
mean, I
tell a
know that
kid looking for their
I
first?
needed something that was minimally invasive procedure. I needed something that was, economical. I just every time. I mean, because when you're getting your feet wet with implants, you're going to waste a few implants because you pick the wrong size or because you don't get high enough torque or you just feel like it's not the right situation or whatever. So every time I broke open a $400 implant package, I wanted to vomit because I knew that it was $400 out of my pocket if I screwed it up. And so then it makes you not want to do the implant procedure because you think if I screw it up, I'm out $400, and then I can't charge that to the patient because they know that I screwed up and I can't help it. So the basics of the whole thing is I needed a more economical implant, and as well as I do, the screw design is almost identical across the board. I mean, there's minor differences in how they actually function and how they're placed, but by and large, the titanium screw with the SLA coating is the same.
Okay, a lot of people don't know what SLA coding means.
Well, it's basically, I mean, that you sandblast and so it makes it, the surface rougher, so it integrates better. I mean, that's essentially what it is.
But they're going to email the feedback I get on these deals is, well, she didn't say what brand or what cement. I mean, a lot of times you'll say, well,
Yeah,
how do you do a composite, but the person doesn't want to tell you what kind.
yeah.
So a lot of
The
people want
the
to know just, Stephanie,
the
come on, if I
biggest
had to buy
problem
one
with the
system, what would you buy?
200 and the biggest problem with the 274 implant systems is the education. So you could go to 50 courses and still never place an implant, right? So but the reason that I love OsteoReady implant systems is because it's a system that teaches you how to go home and place your first implant right away without 2,000 hours of implant CE. And because most people that come to the courses already have it. So you don't have to know every single thing to put in an immediate implant. You take out a root that's the same size as the screw you're going to put in, and you actually just place the implant immediately. So
So
it's
you
not
chose your friend Brady Frank's system.
right. I did.
So
Yeah.
so what's the trading then? Does he do that all in Seattle, or does he do it across the country, or
There's
does he
some
have
in
an instant?
Seattle. Yep, there's some in Seattle. There's different locations across the country. There's one in Denver. There's lots of different places to go to learn how to do it. But the gist of it is that you'll go home and actually do it. So then you pay for your kit by putting some implants in some of your actual patients. I mean, that's what's really sad. I have so many people that have come to my courses and they've taken hundreds of hours of implant CE, but
So
they never felt confident enough to actually go in and put a screw.
so you're teaching this in your office too?
Yeah, in Des Moines too.
So one of my listeners right now could go to your office and learn how to do these in Iowa?
Yeah, sure.
Well, tell us all about that.
Oh, well, I mean, but I'm also teaching in Denver and I teach in Seattle. So, I mean, there's
Oh,
lots of
you
courses.
teach at the OsteoReady Institute with
Yep,
Brady Frank.
yep, yep.
So
So,
so but I can but a listener can go to Iowa,
yeah, yeah,
Des Moines, Iowa, West Des Moines,
yeah,
Iowa. Is that a
yeah.
suburb of Des Moines?
It's a suburb of Des Moines, yeah.
So talk about your course. Is it 1 day, 2 days?
It's 2 days. It's over the shoulder. It's, really seeing how simple and straightforward it can really be. It's all for general dentists. I mean, obviously specialists can come too, but specialists have different training really. So general dentists are very, very comfortable and confident after a couple days that they're not going to go kill somebody with them. And that's a common thought is that, I mean, they think that it's so complicated that they have to have all this training because they're going to really hurt somebody with it. But I mean, bone heals, people, take a tooth out and the bone heals over and then, you can go put
What's
something
the
in.
website on this? Is that just your DM Smiles, your dental office website?
The implant stuff would just be OsteoReady.com.
Go to osteoready.com.
Yeah.
And how much
Yeah.
is your 2 day course?
It varies. It's a few $1,000s. I mean, it's just like a regular implant course, so it's going to be.
And how much of that is lecture for those 2 days versus clinical?
About half of it's lecture and about half of it's clinical.
Well, you know what you and Brady should do, or you should do it, or he could do it. Is you've never made us an online CE course on Dental Town,
Oh yeah, we
and
really should.
we Howard Goldstein has got
Yeah.
325 courses, and we
Yeah.
passed 550,000 views,
Wow.
half
Yeah.
a million views. So
Yeah.
the best marketing you could do,
Yeah.
and you know why I'm really after you seriously. You know how many complaints I get that podcasts and courses are all white males.
Oh right.
I get that a lot,
Right.
and
Yeah.
I'm so aware of this because I grew up with 5 sisters,
Right.
and my 50 employees, I think 43 of them are women. I mean, I got 2 male assistants, I got a male office
Yeah.
manager, but it's 43 out of 50 are women.
You're just trying to keep some testosterone around you any way you can, huh?
I'm so sensitive to not having any podcasts or
Yeah.
courses by women, and
Yeah.
I went to dental
It's
school.
true.
I was lecturing in a dental school, and it was I put out the magazine each one, and this little 5 foot dentist came up to me and she said, "Oh, nice editorial board, all men," and she flipped the magazine at me. And it like hit my mouth, nose, and I was like stunned, and I felt so bad. And I finally got Betty Fleming, Elizabeth
Yeah.
Fleming,
Yeah.
my backyard, and I'm always on the hunt for
Yeah.
women role models because
Yeah.
and that's
Well,
why.
because there's so many of
In
us in the
fact,
field.
I
We
don't think
need
I
it.
should say this on a podcast. I know this is totally inappropriate and off the record, but you're in Iowa, which if you're listening from around the world, because people listen to this on iTunes from every country on earth, but in the United States, it's pretty where Steffany lives. is Iowa out of 50 states, and the whole election starts in Iowa, and
Yes.
everybody tries to win Iowa because if you win in Iowa, it sets the tone for the whole pace. And
Yes.
what was my political point I was making? I'm actually going to vote for Hillary because I had 5 sisters and I got a 3-year-old granddaughter. My reward for not
Oh,
killing
yeah.
my 4 boys was they
Was
made
a
me
granddaughter.
a granddaughter, and I don't want Taylor to grow
Yeah.
up and
Yeah.
think that all presidents are males. And I
Yeah.
don't really care which president I vote for because they all lie. They're all
Yeah.
lying. I mean, everybody
There's
I
that.
vote for. I mean, George Bush said he was for smaller government, and when
Yeah.
he left 8 years later, there was 27% more employees.
Yeah.
So that'd be like you started with 100 employees and he ended
Yeah.
with 127, and he campaigned on smaller government. Bill
Right.
Clinton said he wouldn't pass NAFTA, and the first thing he did in office is pass that. So
Yeah.
when it's all done and said, I don't want Taylor to
Yeah.
grow up and think all presidents are
And
boys and I'm
I'm
not a
glad you
boy.
said that though, because my 15 and 12-year-old daughters who are amazing, they, if you ask them today, do you think you could be president someday? They'd be like, sure. Yeah. Why couldn't I be? I mean, they're just like, they
But
just know they could.
but is that because of Margaret Thatcher pioneering the way, the Iron Lady in Britain, or is that because the
I
Germany's
don't know.
president's a woman?
Yeah, I guess so. I mean, I think they just think that if they wanted to, they could. That anything's possible
Cool.
for them. Yeah, yeah, it
That's,
is cool.
so I wonder
Yeah,
how many
your
viewers.
your granddaughter will rock the world. I guarantee
I
you.
wonder. I wonder how many viewers I just permanently lost for the rest of my life by saying I'm going to vote for
Yeah.
Hillary Clinton. That's
It's early. I mean, it's possible you might change your mind.
yeah. But it is. She totally has my interest. And if you can find me any other women role models that want to do a
Yeah,
podcast or online,
yeah, absolutely.
so I right now, if you surf those 335 courses or whatever, just
Yeah,
man. So I would love to have a course by you.
yeah. Okay.
And also, if you and you know what's never been done on the internet is a complete continuum on how to place an implant. I mean, it's all,
Oh,
everything on the
yeah.
internet is a 1 hour course, and I don't think you can teach a kid in 1 hour how to place an implant. I think it would take at least 3 hours or 6 hours or eight
I
hours
think
or
you
nine
could.
hours.
I could teach them how to do a simple one in an hour.
Well, then make me that
Yeah.
course.
Okay.
Make me
All
that
right.
course.
Now I promised in front of a bunch of people, so I have to do it, right?
Yeah, and when they see your picture, your avatar, and Brady Finks, they're all going to watch yours anyway. So the women will want the lead, but
Well, you know what? That's
so
interesting that
I
you
want
just
you.
said that, though, because I mean, do you think women dentists want to be led by women? I mean, I do. I have some amazing women friends that in dentistry that have been huge mentors for me. Lisa Germain and Sonia Lazzie and some of these really amazing women. But you're right, there aren't as many as there should be.
Are these dentists?
100%. Yeah.
Well, let me podcast interview them.
Yeah, I will.
So send them to me because
Yeah, I will.
I need be better
You
at
want to
that.
surround yourself with more women because you don't have enough, right?
So I want to address another question. There's a rumor flying around that Straumann says for the first time ever they sold more units of implants in America to general dentists than specialists. So there's a
Good.
rumor that number has changed. And
Good.
then we have the overwhelming data that Korea has 20,000 dentists and 3 out of 4 dentists place an implant every month. Germany
Yeah.
swears their dentists
80% of Europe general dentists, 80% of general dentists in Europe place implants.
Okay, so
Yeah.
you're talking to 7,000 people, so probably
Yeah.
6,000 have never placed one. Talk to
Yeah.
that person.
So this is what's really great. So bone doesn't have nerve endings. It bleeds, but it doesn't have nerve endings. So you can't, once you get past the soft tissue, and everybody thinks you have to flap the soft tissue, but if you have a molar site, say you patient's missing 19 or 30, which is about what, half of them?
Yeah.
I mean, lots and lots and lots of people missing 19 and 30, and you have this much bone, and you want to go and you want to put an implant in that's half the size of the bone that you have. What are you going to hit? I mean, you know where the nerve is because you're really, really, really conscious of where the nerve is.
They're
Stay
afraid of
5
hitting
millimeters.
they're afraid of hitting the
They
inferior
are.
nerve.
So stay 5 or 6 millimeters away from the nerve. huge companies have been built on the principle that you can place a short, wide implant in that space. So if you want to place a 5 or 6 millimeter wide implant with a 8 millimeters long, what are you going to hit in 8 millimeters? Your nerve is 16 millimeters down there. There's no way that you can hit the nerve. I mean, it's sure there is a way. Please don't make me think that you're going to go out there and just do willy-nilly whatever. But I mean, carefully measure. We're scientists. We're mathematicians. I mean, we know math and science. We can figure this out. It's not a complicated formula. Take your X-ray and use your measuring tool on your software and find out how long you have before the nerve. And if you can't see it, take another view. Take something else that makes it easier to find. But you can't. I mean, it'd be like having a basketball hoop that's 10 times the size that you need for the basketball to go through it. It's not a difficult procedure when you're talking about really simple, straightforward. And people make it so much more complicated because we're told in dental school that it's the realm of the specialists and that everybody that is placing an implant should be doing it only if you're trained for 4 or 5 years in residency to do it. But here's what happens. I mean, oral surgeons that are your age or my age, I mean, we're not that far off age-wise, but if oral surgeons that are our age, what kind of implant training do they get in residency?
Yeah, hardly none.
None. I mean, literally none.
In fact, 70, when I was in UMKC in 87, the
Yeah.
two oral surgeons placing implants, all
Yeah.
the instructors called them butchers and crazy and she had their license taken away and they were doing blades and
So
subperiosteals.
it's only been 15 or 20 years that anybody's been placing implants.
It was quackery at UMKC from 84 to 87.
Yeah.
And you'd ruin your reputation if you tried doing it.
Right. So there's no person on the planet that's really more than 15 or 20 years ahead of you. I mean, it tops. So anybody that graduated from oral surgery residency or perio residency in the last 15 years didn't get any different training than anybody else is going to go out and get in the marketplace. I mean, we're going to go take some courses and go figure it out.
If they're listening to you, if they go to, what is it, OsteoReady.com? Is that the website? OsteoReady.com?
OsteoReady.com.
Okay, how much would the starter kit cost?
Starter kit's $5,000.
And does that come with any CE?
Yeah, it comes with the CE. It comes with the implants. It comes with all the drills that you need.
So $5,000, they'd get the system, the 2-day hands-on course.
Well, you had to pay for the course separately because most people come and figure out if that's for them. But I mean, for less than $10,000, you can get an implant system that's top of the line that you can use tomorrow.
Okay, well, it's all fear. I believe that.
It's all fear.
And the anthropologists, and the sociologists, and my favorites, Deza Morris wrote The Naked Ape. There was, who's the guy who, the hierarchical scale, Abraham Maslow. They said that fear is much greater than greed, because if you're dying of thirst and you look at that pond and there's two crocodiles looking right at you, you ain't that thirsty. So the 10 biggest plummets on Wall Street are much bigger than the 10 largest single day gains. So I'm just going to throw a fear question at you. Yeah, but Steffany, but you're saying just place an implant, but don't you always have to bone graft too? And I don't know anything about bone grafting, and don't you have to bone graft around it to do it right? And I don't know bone grafting.
Well, this is what's really great about a GP common sense course that everybody can follow. And literally, I honestly believe everybody that has a dental license can follow this, whether you're a year out of school or you're 30 years out of school or any place in between. If you choose a case that has enough bone and it has enough height of bone and it has enough width of bone, they're slam dunk. I mean, they're so simple. They're 5-minute procedures, and there really isn't anything that's super, super complicated about it. If you need bone grafting, if you need sinus lifts, if you need that kind of thing, choose the 80% of cases that are very simple and very straightforward and refer out the 20% that are complex. And that's one of the things that in the 2-day course, we teach people how to decide between those two. What's simple and straightforward, what's difficult. And if you have a huge, huge spot of bone, in between two existing teeth, and they have all of their teeth except for number 19, and you have this giant space for bone, and you can put an implant right smack dab in the center of it, there's nothing hard about that. And you know where the nerve is and you can avoid it, and it's just not that difficult. And I know that sounds like oversimplification, but it really is that simple. And that's what's great about coming to the course, watching me place the implants, where I prove that it just is that simple.
I hope you comment on my Howard Speaks this month. It was on whether or not you need a surgical guide. And
Yeah.
I want you to
In
address
a
that.
lot of cases, you don't.
But
In a lot of cases,
it was the most controversial Howard Speaks I've read. I've written a
yeah,
monthly column every month since
yeah.
'94. This
I
thing
love
had
that you don't mind being controversial. That's one of my favorite things about you.
well, what my thinking is on that is that when I was in dental school, I read so many articles, and like on practice managers, you should be nice to your patients. Like, really, is someone saying not be nice? And they're saying you should have a really clean office. I'm like, really? Is someone else saying there should be a dirty office? So what I always do on mine is I don't want to talk about what everybody agrees on and what everybody
Yeah,
knows. I always want to find out where the big controversy is. So I'm going to throw the controversy at you, and I hope
yeah,
you log on to my Howard Speaks
yeah.
because it's
I'd
already
love
got
to.
like 50 comments, and you're either far to the
Right.
right, far to the left.
Sure.
The deal is this. My problem with implantology lectures and instructors is
Yeah.
that 95% of crowns are done one at a time. If
Right.
you go to any crown and bridge course, it's always about full mouth rehabs and how to
Yeah.
open the bite and a face bow transfer. Then you go
Yeah.
back to your office where the rubber meets the
Right.
pavement and it's all single
Yeah.
units. And on
Yeah.
implants, 95% are single units, and the most commonly missed tooth is a first molar.
Yeah.
And you got a molar, you got a second bicuspid in front of it, a second molar
Yeah.
behind it, and there's just people out there saying you have to have a surgical guide on
Yeah.
100% of all the cases. And then
Yeah.
and then there's surgeons
Well, I
who
mean,
have
what is
placed.
wrong with you that you can't hit that giant space
I know.
between the two teeth?
I know, and they're just like if you don't have a surgical guide, you're a
Yeah.
hack.
That's crazy.
Yeah. So I
Yeah.
think what you and I are is
Yeah. I mean,
practical.
of course we're practical. We live in the real world in a real practice every day. I
Right.
mean, I did dentistry this morning. I'm sure you did too. I
And,
mean,
and, I, and I said, if you have to have a surgical guide when you got a
yeah,
premolar in front, a molar behind, the
yeah,
head's right in your lap, their head's
yeah.
in your crotch, you're looking
It
straight
is.
down at it. If you can't nail that, you should
Yeah,
just go home.
yeah. You
And
really
no,
should.
and they didn't like hearing that.
No, no, they probably didn't. But you know what? Yeah, for complicated stuff, a surgical guide makes sense. For really simple, straightforward stuff, you're an idiot if you need one. Sorry, but I'm channeling you.
So then, what is the indications where you really need to have a surgical guide? Or,
Well, if you really, I mean, I have CT in my office, so if you really have a case that's super, super difficult and you don't think you have enough bone and you don't know exactly where it's going to go and the soft tissue is overgrown a little bit and you really don't know how to hit the bone that's underneath the soft tissue, then a surgical guide makes sense. But if it's a straightforward case, which is 80% of the cases, that doesn't make any sense.
now, do you think they're very necessary for when you're parallel, where you're trying to get? Do you think like what if you're trying to put two implants or three implants?
Well,
Do you think you have to have a surgical
why,
guide so they have to draw, or do you think they don't even have to draw prosthetically?
why were angled abutments invented then if everybody draws all the time?
But do you think surgical guides prevent having the need to angle abutments, or?
Maybe, but with Curva B and Curva Wilson, there's variations in that anyway. So it's not like you're putting a picket fence in. I mean, there's differences not the roots all don't line up straight parallel. There's actually some variation in that. So I don't really think that most of the time, I don't think a surgical guide helps that much with that.
I feel like I'm spending too much time with your amazing mind on implantology and not enough time on the other 6 month smiles, because when you said that your course teaches you the 80-20 rule, pick the
Yeah.
80% that don't need a
Yeah.
sinus. Pick the 80%
Right.
easy ones. Ortho is the perfect 80% because 5% are
It
class
is.
3, which Jay
Yes.
Leno, which God,
Yeah.
that's what orthodontists don't even want to do class 3.
No.
And then 15% are class 2. He doesn't
Right.
have a chin. When he smiles, his
Yep.
liver shows. That's a tough deal. But
Yeah.
80% of ortho is just class 1 molar, class
Right.
1 canine. I just
Right.
want to kind of dress them up, make them look whiter, brighter, sexier, cleaner.
Yeah.
Talk about 6 month smiles.
Well, 6 month smiles is really kind of fits that niche of the adult patient that either had ortho and they've had relapse, or they have serious issues with, they just never were able to have braces when they were a kid and they've always wanted their teeth to look a lot better, or like pre-restorative cases. A lot of times, you have a veneer case where the teeth are all over the place and you can't do veneers on that case. I mean, there's no way that you can do a nice cosmetic case if the teeth aren't somewhat orthodontically aligned. So 6 month smiles kind of fills the gap in between all of that. And it does it because if you poll adult patients, a large percentage of those patients, I would say probably at least 80%, they don't want to wear metal braces and they don't want to wear them for 2 years. So the length of time of treatment is a huge issue, and the metal braces is a huge. I mean, I wouldn't wear metal braces, and I'm not that vain, really, believe it or not. But I mean, I really do, I wouldn't put metal braces back on. I've had them for 3 years when I was a kid, and I just don't want to do it again. So if you told me that you could put cosmetic braces on me and it would only take 6 months, I would agree to that. But I'm not going to agree to something that's going to take a super long period of time and looks really bad. So I mean, that's what 6 Month Smiles is really about. And again, it's cases where you wouldn't look at the patient as an orthodontic patient because it's too mild to send to the orthodontist because it's kind of a silly minor case. But it's also something that just really jumps out at you that they can have a nicer smile.
But don't you think the orthodontist with ortho is the same problem with oral surgeons and implants? I mean, if you go to an orthodontist, I have people that go in there and want
everybody
something
gets
straightened,
grafting,
and they wanted, here's 2 years of ortho, maybe orthodontic surgery, this. I mean, it's like they don't do market segmentation either.
No.
I mean, what surprises me is that
Yeah.
orthodontists don't even offer 6 month smiles.
Well, in my mind, would it be better to put 8 or 10 veneers on somebody, or would it be better to straighten their teeth that already look good? They're just not in the right place. I mean, we did way too much cosmetic dentistry for a long time when we really should have been doing more ortho.
I know.
So,
and you know why I knew that was bullshit to begin with?
Yeah.
Because the dentists, all these big cosmetic dentist names that were peeling off everyone's enamel for 10 upper veneers made their own daughter get ortho and bleaching.
Yes. Yes.
And so now that you've been out 2 decades ago, when we peeled all the enamel off and did 10 upper veneers, how many of those teeth died and needed root canal 10 or 20 years later?
Lots.
Yeah.
Yeah.
I mean, on what percent?
Well,
what percent would you say?
Oh gosh, I don't know, 40 or 50% maybe.
Yeah, and it's like if you won't do this on your own, my own 4 boys, you had 4 children too, didn't you?
Yeah, I have 4. Yeah. I just have 2 boys and 2 girls, so I got lucky.
Yeah, you did. But I got a granddaughter. Do you have a grandchild?
I know. Not yet. No,
Oh my
I have teenagers,
God,
so I'm still in purgatory.
They're the but anyway, that's amazing. But I'm a firm believer. If you wouldn't let your own kid do this, why are you selling?
And I wouldn't.
And I've also found out as I get older. You were talking about leadership, that as you get older, you have more confidence and it comes out and you become a leader just because you exude leadership more. And so many girls that I let the tail wag the dog 20 years ago and put veneers on them. Now I can have a fatherly talk to him and say, look, 2 years is going to go by this, or 6 months or whatever. Let's just unravel these things.
Yeah.
If you just want to look cuter on your Facebook selfie, let's unravel this for 6 months. Let's do some bleaching. Let's do some whitening. And you're a pretty girl. This will be good. I don't want to shave down all the enamel off your teeth.
Right.
Because I think
don't want to condemn them to a lifetime of maintenance. And that's not fair. Yeah.
Okay, so I don't want to throw you under a bridge, but with dentaltown.com, no dentist is practice solo again. There's kids out there all by themselves saying, well, Steph, Steffany, I hear, by the way, is Steph okay with you, or is that?
Yeah, of course. Yeah.
Okay.
Yep.
I hear there's 6 Month Smile. There's which was Ryan Swain started that company. There's Power Prox, which is who?
The
guy that eats.
Yeah.
The guy
that guy.
Wow, come on, he'll tell me if I don't remember his name. There's Invisalign. There's what's the other one? Clear Correct.
Yeah.
What is what would you tell those people that are driving to work right now? They're all alone. They're kind of, come on, help me out. I don't want to take 4 courses. I mean, what's the difference between 6 Month Smiles and Power?
Well, Invisalign moved their original course to like a half-day course, because I did tons of Invisalign for a long time. Invisalign's really great for patients that are super compliant, but you can't predict who's going to be compliant straight out of the gate. And I got tired of patients saying, sure, I'm wearing the trays, sure, but nothing would move. The teeth wouldn't move. And I've done enough cases that I know if they wear the aligners, the teeth move. So 6 Month Smiles is where you can, you get automatic. Control. You have control, and it's not. I mean, as well as I do that the 4 years in oral surgery residency or the 2 years in orthodontic residency, what they're really learning to do are the super complicated cases. They don't need 2 years to learn the simple cases. That's straightforward and simple. It's tooth movement. It's force and how everything actually will respond to the force. So that's not a difficult thing to learn. It's doing the super, super complicated cases and finishing them so you don't yank their teeth out along the way.
So
So 6 Month Smiles has good science behind it, and I think that's the difference. I think that's why it's grown into a real company, because it really actually has the science behind it, and it works really, really well.
I'm not giving up. I gotta find the my buddy on 6 month on Power Procs, or I'm gonna feel
It's isn't it Rick something?
Rick DePaul.
Rick
God,
DePaul. Thank
I'm
you.
sitting
Yeah.
here. I having dinner with him and his wife. In my mind, I'm like Rick DePaul. So back to the Invisalign no compliance. Is this a wrong bias of mine? But I got, to me, it seems like little girls would do anything to look prettier. And
Yeah.
that little boy with a burger hanging out of his nose and has wore the same shirt 3 days away, he ain't gonna wear his aligners. And I'm to the point now at 52 years old. I tell mom,
Yeah.
I'll do it on a young girl. I'm
Yeah.
not doing it on your high school boy, because your high
I've
school
had some
boy,
boys that actually are pretty compliant, but
and you call those
I
gay.
have kind of maybe I don't know, but they have to, the boys have to look me in the eye themselves and really say, okay, yes, I really want this for myself, instead of mom or dad wants it for me.
And it's that look. You can
It
tell.
it
You can
is,
tell when
and
a
I want
guy.
to know if they're a good student, if they're if they're a firstborn, they're probably pretty rule following and that kind of thing. Kind of, I want to know the interaction between mom and dad, and kind of if they seem to be respectful to mom and dad. If they roll their eyes at mom and dad, heck no. There is no way. They're not going to do anything mom or dad says, and they're certainly not going to do what I say.
They gotta have a. They have to have. If they're teenagers, they have to have a look that they're into
They
beauty.
they do.
And
Yeah.
if they
Well,
have a look,
they have to be far enough along. I mean, they can't be 12. They can't be 13 or 14 usually. I mean, they have to be far enough along that they want it for themselves, I think.
yeah, yeah. So what I like about what I like about 6 month smiles is I'm in control. If I bond that
Yes.
up to your tooth, it's all
Yeah.
me.
Yeah.
And if I have a gut feeling that
Yeah.
it's going to be up to you and you're going to make me look bad, I don't want to do it. So how much do you charge for? Do you do regular ortho?
I don't do regular ortho, no, just Invisalign and 6 Month Smiles.
And
So
what would
I charge 3,700 plus 500 for retainers for 6 Month Smiles.
and what are the retainers? Is
So
that a fixed
4,200.
fixed bridge, or is that a
We do a fixed and a removable. We do a fixed six unit
on the lower
lingual
anterior,
bar. Yeah, and then we do an Essex,
for upper and lower?
upper and lower. Hmm.
Upper and lower. Amazing.
Yeah, yeah.
So
I just don't want to have any
but
excuses
are
from
you
them
doing
that
Invisalign
something
now
came up.
still? Are you still doing
Yeah,
Invisalign?
a little bit. I did a little bit, but it's pretty few and far between because it's just hard to get compliance. And I've done like
And it's
700
expensive.
Invisalign cases. It's expensive. Yeah,
The lab bills
yeah,
are expensive, and I
yeah.
think that's what's brought on some
That's
knockoffs. So, and what are
oh
the
sure,
knockoffs?
absolutely.
What is it? They're correct.
Yeah, and like Simplify or Simple 5 or something like that. I mean, there's several that are kind of there's nothing that's as comprehensive as Invisalign. You can do some comprehensive ortho with Invisalign.
One thing you want to do in business, you want to have a protective moat around your business, and
Yeah,
like a patent or
yeah, yeah, right.
something. And dentistry's got one, because the schools,
Yeah,
not anyone can open up a restaurant
right.
or a dry cleaner, but you got to go to 8 years of
Yeah,
college to open up a dental office. That's a
yeah,
huge restricted barrier to entry. And I always think when these companies come out and they charge an arm and a leg, they're
yeah,
forcing a competitor.
yeah. Well, they actually still believe that dentists are all just wealthy beyond belief, and the sheer numbers tell us otherwise. We're still regular people that have a regular income.
Yeah. So Stephanie, talk to that person who's living in fear. What are they afraid of learning 6 month smile or Power Procs with Rick DePaul?
Yeah.
Well,
So
what's the fear factor? What do you
I
think's
think
holding
the
back?
fear factor is that they've been told for so long. I think the fear factor is that somebody else is going to find out that they're doing it and that they might not be doing it perfectly. And the fact about ortho, the great thing about ortho and putting brackets and wires on a tooth is if you can move it one way, you can move it the other way. So if you move it someplace that it doesn't, really belong, you can fix it. And, it may take a little longer than 6 months, or it may take, a certain period of time, but you should always tell them longer than that anyway, because that's silly. 6 months for most people, but for you, it's 8 or 9,
And
But
and
the fear is that you're going to screw something up that you can't fix. And the fact of the matter is that if you can move the tooth one way, you can move it the other way.
and you know what what got me into ortho 28 years ago is in 1987, you sent anybody to ortho, they just pulled the 4 first buys.
Yeah.
That's all it was.
So now everybody has sleep apnea.
They only have one treatment. Pull the first
Yeah.
4 buys, and then they
Yeah.
spend about 6 months straightening the teeth,
Yeah.
and then a year and a half trying to close that
Close the
gap of where you
space.
pulled these big old 10 millimeter or
Yeah.
mesial. And what I didn't understand about needing spaces, on a lot of people where they'd say, you need to pull 4 bicuspids, you might just
Yeah.
need 5 or 6 millimeters. And I
Right.
could sit there and take out the MOD amalgams and put them
Yeah.
in direct composites, but with less contact. Just put a top
Yeah.
file there
Yeah.
and lighten the contact. And I could put a wedge in between the teeth and then go in there with a
Yeah.
alignment and I could get all the space they
Yeah.
needed just by removing all the 2 surface amalgams and a little
Yeah.
slenderizing, and then I could do
Yeah.
the case in 6 months,
Yeah. Isn't that crazy?
and their amalgams turned white.
Right. That's magic. Yeah.
But anyway,
You're right. We live in the real world. We have, regular patients that want what we have practically to offer.
well,
Yeah.
my gosh, you are going to have a lot of homework. You promised me you
I
contact
do. I
Scott
did promise you
Shackton,
lots of things. I
Brady
know.
Frank, that you're going to build me some online C. How many online C courses are you going to build us?
I don't know. At least one for sure.
Well, you need to have one on. I mean, you're an amazing leader and marketing person. You're the front man.
I like that.
You're the Bono in you too. I mean, you're the front face. I mean, I have seen you on the news. I mean, a dozen times. I follow you on YouTube.
Yeah. Yeah.
So every time you post that on YouTube or Facebook,
Yeah.
I see it. And in fact, I wish you'd start a thread of all your deals. You also were going to post on this month's Howard Speaks.
Yes.
Because it's right or left, no in between. But final question, we're in overtime. It's a 1 hour and 1 minute. So I'm one question us old guys always have about women that I want you to answer. I only have 7 restorations in my mouth. They're all gold.
Right.
How come
Yeah.
every time I see a woman, she got 3 gold earrings, gold wings, watches, gold anchor? Right? They'll even have a gold BB in their belly, and then I'll say, "Can I put a gold crown on number 2? It's waved back in the mouth."
Yeah.
And they look at me like I'm from Pluto.
Yeah.
Why is gold perfect on every part of a woman's body except her molars? And
Smoke and mirrors, Howard.
smoke
Smoke and mirrors.
What does
I
that
don't
mean?
know.
You don't.
It means that we want to appear that we have perfect teeth, but yeah, I don't know.
So then you're saying gold then symbolizes there used to be a flaw, whereas
I
a
think
gold
so.
earring or a gold ring or a gold ankle.
I think in my mind, as a dentist, teeth are supposed to be white. I mean, even though you can put a gold crown on it, I feel like teeth are supposed to be white.
Huh. And
Yeah.
I would, and being a dentist,
But my jewelry is supposed to be gold. I don't know.
because
Yeah.
I all mine are gold.
Yeah. Really, women want diamonds, honey, not gold.
Okay, they
Yeah.
went gold. Okay. Well, on that note, thanks for promising all this stuff you're going to do for me, because I really want you to be on that
No,
online.
I would love to.
And if you
Thank
get
you so much. You just
and
are,
when
are
I go
so
to the
much
dental
fun.
schools, they're 45% women.
I know.
And they don't want to log on Dental Town and see the all man show.
I know. All right.
So
Well,
if you
we're
got
on.
women, other leaders, bring them on, because
Okay.
I want them to see women role models. I don't want them
Okay.
to think that they have to go work for a man Rick Workman or a
Yeah.
man Stephen Thorne, that they can
Yeah.
be like you someday, because
Yeah.
a lot of them want to be like you.
Oh, well, thanks. That's really nice. I appreciate everything that you do for dentistry. You're amazing.
All right, Steph, thanks for giving me an hour of your life today.
Thanks. Take care.
All right, bye-bye.
Bye.